analysis. Do I succeed?
Yes.
Okay.
The consciousness of the baby evaluate.
Okay, Gary, are you responding to me? He's responding to me? No, he's not responding.
So start to ventilate the patient.
Yes. Okay, we start to ventilate with the breathing mask with reservoir at 100% of oxygen.
Okay.
Okay, I'm ventilating.
Good ventilation.
You are ventilating well.
The chest is
symmetrical.
moving. Yes, chest is moving well.
And what did you feel? What did you feel? What did you
I can hear the more with the crepitations or
Crepitations, yeah.
not anymore.
So, okay. We do some blood exam.
Okay. And collect some blood for doing a nega. Okay, and some blood exams.
Okay. Let's see if the oxygenation still 85.
Okay. How is the ega?
How is it?
Still waiting.
Okay.
2 minutes.
2 minutes.
Okay, 2 minutes, okay. Okay, maybe it could be a design shock. So, because the beta, we have preload signs, crackle in the bilateral crackles, and the patient doesn't improve. And with a positive ventilation, okay, normal. Okay, so we can start to do some fluid.
Yeah.
But we have preload signs.
So I'm going to do. I'm doing for 5 ml kilos in 20 minutes. Are you agree?
No, I'm not agree. We have to use a notebook to improve the function, the heart function. So start please.
Okay.
Oh no, see, yes, sorry. Use a notebook for the heart.
So I'm I'm ventilating well. Okay. pH 7.2. Okay. Okay.
Yeah, so we have an important respiratory insufficiency. We should improve the ventilation, but try to put mask to improve the ventilation, but we need to check
the airways maybe.
Yes, check the airways.
Does it have secretions?
There are some secretion in the mouth.
No.
Okay, try to put the nasal mask to improve ventilation.
Okay. This is already. Okay, hold another side anesthesia.
Yes, hold anesthesia.
So I have the dobutamine. I'm starting the infusion of the dobutamine. That is 8 micrograms. So I'm starting minutes. So I'm starting the infusion. Done.
Okay, it's just starting now. Yeah.
Okay.
Okay.
That's your one intravenous. The dopamine is going into one.
There is no.
We don't know what is the first problem of the guys. We know that this is a problem in B, but the ventilation doesn't improve.
Can we have a screening our best for the moment? Yes.
So we can change well.
Yeah, it's symmetric.
Why the patient doesn't improve the ventilation? So, yeah, evaluate like this.
Okay, so well, for the moment, the oxygenation is still the same. Okay. Yes. Always okay.
We are waiting for the anesthesia to intubate the baby. We can evaluate the quantity.
Let's check the sensor.
Okay, time. Can I ask, when you went to the corner, right?
Yeah, I could. We have 2-year-old boy
were you called?
The anesthesiologist. Sorry.
That's okay. Okay, that's great. Very good. All right.
Chiediamo a lui se vuole che lo togliamo. Non so se lo vuole far entrare qui.
Grazie mille per il supporto. Okay, so when we're stressed, so they need to tell us. They did okay, but I think the one thing that we didn't know is that they called for anesthesia right at the beginning. It's okay. They did, they did a lot of good things. They started battling early, but I'm going to have to just make sure that the teams when they come in, that they tell us exactly what they're doing. If they're going to go and talk to anesthesia, they turn to you and they say, I'm going to go and call anesthesia. And we missed that. Yeah, okay.
How you get on your face? How does it go?
Hold that thought.
Okay. The mannequin is good. It doesn't go like this. You know what I mean? But I think for the first team it's a challenge. You know? Morning.
Okay, so is there a coach in here? No, just the team. Okay, that's okay. What will happen is that I will start by giving you the scenario, and then you start. Okay. Fabia, what language are you most comfortable? Have you been practicing in Italiano or English? That's okay. That's fine. It's going to be Raffaele is going to be talking to me constantly, but that's okay. Now, if you need what you need to make sure, we are only as good as knowing what you are doing. So you need to, if you're talking to each other, make sure you're saying to Raffaele, I am checking this, I am asking for that, right? Because I am calling for help, because otherwise we don't know. So you need to make sure that we understand. Does that make sense?
Yes.
This is going to go for 10 minutes, and then we'll go back into the room and we'll end up talking about the case. Okay?
Yes.
All right. Okay.
No.
That's okay. Okay. So I will give the scenario. If you need Raffaele to translate, that's okay. All right. Would you like him to translate?
No, we try.
You're
We can
okay?
try.
Okay. So this is a 4-year-old boy who was brought into your hospital by the family today with breathing difficulty. He's been admitted to the hospital. The nurses have called you to come and see the child because he is having more difficulty breathing.
Okay.
Understand?
Okay.
Right. Okay.
Ok ragazzi, abbiamo un bambino di 4 anni portato dai genitori per difficoltà respiratoria, quindi io sono il team leader, ha dei farmaci, Marti è valutazione e compressione, Marti è Eliana monitor e Mary Paul è timekeeper. Okay, so he's here now.
You're in his room.
Okay, perfect. So let's start with the initial evaluation. How is the appearance? Is he conscious?
His eyes are open, but he looks confused.
Okay. And how is the work of breathing?
Severe work of breathing.
Okay. Okay, and the color of the skin?
Pale.
Pale? Okay. Perfect. So, è un bambino critico, valutiamolo per la valutazione primaria. È un bambino che ha distress respiratorio severo, è pallido ed è confuso. It was in the hospital or from home?
He's from home into the hospital.
Okay.
He's on the ward.
Va bene, prendiamo i parametri e facciamo la valutazione primaria.
Okay, let's start with the areas are open and patent.
When he is breathing, his chest is moving.
Ok.
Quando respira il braccio si muove.
Quando respirare mantiene il flusso confortevole.
Once in comfortable.
Position for breathing.
Abbiamo un peso.
Weight, position.
20 kilograms.
20 kg.
Perdite mantenibili.
Patent airways.
Ho detto che ipotrasmesso a destra, frequenza respiratoria.
Cosa hai detto prima?
Ho sento ipotrasmesso a destra.
Less, more on the left side. Oh, on the right side.
So on both sides, crepitations.
Ci sono crepiti da entrambi i lati.
Ok ragazzi, quindi crepiti entrambi i lati, la saturazione è a 100%, la frequenza aumentata. Direi che lo supportiamo con una maschera con reservoir, snore breathing e partiamo con 10 litri al
10
minuto.
liters per minute.
Ok, vediamo se
Centrali sono presenti periferici.
Central pulses are present, the peripheral pulses
Strong.
sono forti, sia centrali sia periferici.
Refill capillare, ossigeno 100%.
3 secondi.
3 di refill capillare. Ok, a segni di sovraccarico destro per megalia e dell'intubo
2 centimeters.
di fegato.
2 centimetri.
Ok, 2 centimetri. Ok, quindi la C cosa? Allora, i polsi periferici e centrali sono avanti, legati e in quel contesto alla diastolita bassa. Ok, presente 30 la diastolica ridotta, 2 centimetri di fegato. Io provo a prendere intanto un accesso venoso.
Ci sta anche
Ci sono riuscita? Ok.
Yes.
Sì.
Ok, va bene, quindi ragazzi facciamo un'analisi, ok? Allora, quindi abbiamo una frequenza, una saturazione che è ancora bassa, possiamo potenziare aumentando la litri, ok?
Aumentiamo i litri a 15.
Ok, ha dei crepiti laterali, a distress e a fegato. Ok, perfetto. Ok, allora facciamo così, vediamo un attimo la D e la E, nel frattempo se vogliamo fare delle domande ai genitori relativi alla sua storia.
Parents are not here.
Non sono qui i genitori.
We know who is well. No medication.
No farmaci, no allergie.
Ok, perfetto. Allora, possiamo fare così. Visto il refilo allocato e la pressione che la sistolica è adeguata, la sistolica un po' più inferiore, possiamo mettervi una fisiologica, però facciamo 10 ml per chilo in 20 minuti. Ok, facciamo ci manteniamo bassi e facciamo 5 ml per chilo per ora 20 minuti. Ok, Allora, al 6, ok, abbiamo per respiratorio aumentata.
Respiratory rate? How is the respiratory rate?
Avvio volo con soluzione fisiologica decente media.
Invece, per quanto riguarda la B, è A, B, B, U.
4. Bilateral reactive.
Reattive bilaterali.
And the glycemia.
Cosa?
Glycemia.
Glicemia.
It has 5 millimoles per liter. Do you know millimoles or
No,
milligrams?
milligrammi.
Milligrams is 80.
80, perfetto. Ok, lesioni alla cute,
You can see something on the skin.
temperatura.
Body temperature.
It's up there. Is it temperature?
Dove sei vederla?
Ok ragazzi, allora è arrivato a febbre, ha rangi, diciamo recap, quindi ha le idee che sono verdie ma ha bisogno di un supporto respiratorio aumentato, cambiamo, mettiamo un high flow nasal cannula, ok? Ce l'abbiamo high flow nasal cannula.
Yep, high flow is available.
Ok, perfetto. E in modo tale da mettere una, partiamo con 4, questa è l'infiniti, ok? Facciamo facciamo 5 litri.
So you put high flow on, he's not responding. Eyes are closed,
Ok,
he's not responding.
Mentre degli altri pulsi ma lui non risponde, gli altri sono chiusi.
ok, allora,
Strong, forte.
Poi si sono forti.
allora sì, troviamolo. Allora, anche perché l'imogassanante dimostra una base di acidosi respiratoria, quindi chiamiamo anche rianimatore per avvisarlo che abbiamo un caso di distress respiratorio severo e che vogliamo intubarlo perché i supporti respiratori della nostra non danno le Ok, detto questo ragazzi, quindi facciamo questo intervento. Poi per quanto riguarda i ranchi e il suo fegato, dobbiamo anche considerare un possibile quadro cardiologico. Quindi se riusciamo a fare una traccia ECG e fare un'ecocardiografia, possiamo vedere anche da questo punto di vista come va. Alla febbre,
Esatto, io separerei del paracetamolo, 15 mg per chilo per ridurre la richiesta una maschera laringe attaccata al reservoire ossigeno 100%.
Laringe mask with reservoir and 100%
la tecnica di
Just signs of cardio.
La lettera B somministra tachipirina, paracetamolo 15 mg per chilo, 300 mg. Somministrato.
Quindi ragazzi faccio un attimo un recap per decidere come procedere. Abbiamo stabilizzato le vie aeree con una maschera speciale che stiamo utilizzando, ma comunque è sempre proviamo a avere, siccome la saturazione rimane un po' ancora al di sotto della norma, consideriamo i correttivi della ventilazione.
Si usa anche nel polmone.
Sì, esatto. Possiamo fare un'ecografia per valutare sia il discorso cardiologico che il discorso polmonare.
Lung ultrasound is broken.
Okay.
Right? Echo is coming. It'll be 10 minutes.
Okay, and so the X-ray it's
X-ray will be 10 minutes also.
okay. I will also for the X-ray. Okay. In the meanwhile, sì, stiamo provando i correttivi della ventilazione. Da questo punto di vista con la maschera laringe non è stato adeguato. Proviamo a ventilare a 2 persone. Ok, quindi lui adesso ha un bisogno di un supporto respiratorio. Ha comunque un distress respiratorio, quelli anche bilaterali, quindi potrebbe essere un distress respiratorio sia all'origine della patologia respiratoria polmonare, quindi bronchiolite, oppure un problema di tipo cardiologico. Ok, quindi la scompenso sono bilaterali, nonostante io non scompenso cardiocircolatorio e dal punto di vista della C stiamo facendo un volo lento di soluzione di
Okay, time. Okay, let's get into
Lasciamo tutto.
just you guys go. What's that?
So I leave everything here.
Okay, guys, out.
Potete andare di là, nella stanza del debriefing.
Can I just ask before you leave,
Yes.
the phone calls? What phone calls did you make during the call? Did you call them?
The resuscitator, okay? And when we have to date,
Okay, so that you called them when?
yes,
Okay.
because we are very severe. Okay.
That's okay. Okay, great. We'll be right in. Okay, off you go.
Yes.
Us, because we, if we don't hear, we don't know what you're doing.
Yes.
We can't grade you on it.
That's
Okay. I will start by giving you the scenario, and then the time will start, and it will be 10 minutes.
Can you repeat this?
That's okay. So I will give you the scenario. I will write, and then when you when I finish the scenario, I stop talking. Time starts.
Thanks.
Dopo che finisce di parlare, gli altri.
Ok, perfetto. Guys, control everything on. Yes. There is a that we have the laryngoscope if we should.
So there is no laryngoscope. There's just the equipment that you have there.
Okay.
So if you needed a laryngoscope, you'd have to be calling for who usually has that equipment.
Okay. That's okay, thank you.
You're welcome. Okay? Ready? Okay, so I will start. I'll give you the scenario. Raffaele will translate so that we all understand. All right? This is a 4-year-old that is previously well, that has been brought in by the parents into your hospital because of irritability and fever. He's been brought into the emergency department and he's very confused and has a high fever.
High fever.
That's the story. Okay?
He's arriving.
Oh, do you want to translate? Do everyone understand? Or do you want to translate?
Understand? That's okay?
Yes.
Okay.
Can I make a
Sure.
Okay,
Go
so
for it.
he's arriving, a 4-year-old boy. He was walking to the hospital for irritability and just confusion. He has high fever. So let's put on DPI, is gloves and mask. Federico, you are to monitor Daria, the airways, level of compression, see the drugs, and let's start. He's here arriving.
You're in the hospital, on the ward, on the hospital room.
Okay.
And the nurses have called you because he is confused.
That's okay. That's okay. Let's start with parameters. And how is the appearance?
20 kilograms. He is pale. Pale. He is tachypnic, but not distressed.
non in distress.
Okay, is respiratory?
Mild, he's breathing fast.
Okay.
Not like that. Just
And in the appearance, tickled is about irritability, no?
irritable. His eyes are open, but he's confused.
Gli occhi sono aperti, però
Tasto rosso.
So guys, start with monitorize, please.
Tasto rosso.
That's okay. Thank you. Okay. Okay. Okay, taking the pressure. Just comfort the child. So child, please try to stay. There is the mother.
Not here.
Not here, so please, I'm going here to help you, please. Okay, the airways are clear. Okay, can you evaluate, please, the breathing and steady?
How is the separation?
Yes, 93. Thank you. Normal sound, okay. Respiratory effort, so there is no.
Indrawing, a little bit, equal. Indrawing.
Okay.
And breathing at that rate.
Okay, that's okay. Can we put on oxygen mask with our breathing 15 liters just to help him to the oxygenation, please? And can we evaluate the sea level, please?
Yes, there is a central peripheral pulse.
Has a weak pulse. You don't feel a pulse here.
Periferico no.
Rapid time?
It's 4.
Okay.
The blood pressure that we have is very important. So let's start thinking about immediate access, please. Can you evaluate the DABQ? Is still alert, is verbal, or is ABQ?
So he responds to touch, but he's not talking. He's confused.
He's
right?
confused. That's okay. We are able to take an EV access.
Yes.
Okay.
You've got one ID.
We take him blood exam.
Yes, please. Hemochrome, hemoculture, PCR, hemogas analysis, please, and glycemia, please. Okay. About pupils?
There are 4, both
Okay.
reactive.
Reactive. Thank you.
When she's putting the blood in, she's noticing that there's skin rash that seems to be increasing on the arms and on the legs.
On the, okay.
Inferiori e superiori che sembra che si sta espandendo.
Okay. About glycemia, does we have glycemia?
Is 70 milligrams per deciliter.
Okay. So if we evaluate the skin, the exposition of the child, guys, we see what type of rash? It's petechia,
Petechia and purpura.
and purpura.
It's
That's
spreading.
okay. That's okay. And skin temperature is in 39.
Yeah.
Okay, so guys, does we have from the nurse the information about does we have paracetamol in the last 6 hours?
No.
No paracetamol. So guys, can we take another access because he is very potent. It seems to be a shock, and it seems to be a shock and not compensated shock. So let's start with fluid, but we need another access just to make also paracetamol. And if you are able, can you put a catheter? Yes, please. A bladder catheter, thank you. And
Then get another access on.
oh, we don't have, no, we are not able. That's okay. We start with the bolus fluid. We can think about 10 ml in 10 minutes. That's okay.
I can take him bleeding catheter.
That's a urinary catheter? Yes.
Okay, can we call the anesthesiologist just to...
Yep.
Okay. Yes, can someone talk with the mother, Federica? Are you here?
She's not here.
No, she's not. No,
This
okay.
is previously well,
Nothing.
no medications,
No medication.
no allergies.
That's okay.
I'm
no
starting a
allergies.
bolus of crystalloid 10 ml per kilos in 10 minutes.
That's okay. So we need to reevaluate him every 5 minutes because we need to know if there is a problem on his heart. So it could be a cardiac shock or not. Because it was previously well, he has probably a history that we don't know if he has a history, for example, of cardiac problem. So let's going safely with the fluids, and so we don't have able to put another EV axis. Can we try to another EV axis?
You tried a second one, and that didn't work.
Okay, let's start with the secondary evaluation. We need the paracetamol. Can we do the paracetamol in the same line of the bolus? No, we are.
You can do whatever you want.
Okay. Let's start with paracetamol, please, because we need to control the fever. Because if we have a shock, we need to control the consumption of oxygenation. Thank you. And let's start with the secondary evaluation, please. There are signs of preload. There are because we started from little minutes, so there are hepatomegaly or jugulars.
So no jugular. The liver is 1 to 2 centimeters below.
That's okay.
Starting paracetamol 15 milligrams per kilo.
Thank you. Thank you. Can we start other antibiotic therapy? Because
yes.
we already did the culture, so we need to perform it in the first hour.
I can administer ceftriaxone 100 milligrams per kilo.
Yes.
Okay.
And about secondary evaluation, about head, there are signs of anything on his head. Petechiae, just petechiae. That's okay, that's okay. There are swelling of the ankles, any signs of swelling? That's okay, that's petechiae. Can we call the infectivologist just to perform, for example, when she becomes stable for prepare the operatory room for the lumbar puncture, because we don't know if there is a problem. It could be a meningeal. There are meningeal signs. They still
not sure.
Not sure. That's okay. Just evaluate. Okay.
Before the administration of ceftriaxone, you have some allergies.
They say that he has no allergies, so he can go.
Drug allergies?
No.
No. Okay.
So
I'm taking
the paracetamol, you've got 1 IV. The paracetamol you just finished. You're still trying to give that 10 cc's per kilogram of fluid.
Of fluid? Okay, we are going to go. And so we are not able now to make the antibiotics on the same way because you
well,
have the second.
You stop the fluid to give the antibiotics. It's up to
we
you.
can perform also intramuscular if we need the antibiotics. We can perform because we need to start in the first hour. That's revalidate him. So about RBTO, he's still confused or he lost his conscious because we don't know if there are any.
He's less confused. He's less awake. He's getting sleepier.
He's getting sleeping. Okay. Can you take another reflection, please? The refill. How is the refill?
It's still 4 seconds.
Still 4 seconds. That's okay. And about the pulse?
The same.
Okay. About lung sound.
Clear. Lung sounds are clear.
Are clear, that's okay. So we are probably in septic shock. There are no signs of blood. We did the first part of fluid, so we can increase the fluids. So we can also increase to 20 ml per kilos because he could need this. If it does improve, we can think about inoperable. Because in the flow chart we have to perform 40-60 ml of fluids, but if the person doesn't improve, we can think about it. About ceftriaxone?
Yes, I administer ceftriaxone intramuscolare. Ok? Se sei d'accordo, dato che l'abbiamo riempito un po' di liquidi, potremmo provare a reperire un secondo accesso venoso adesso riproviamo altrimenti in intraossea.
Perfetto. Can we, no, we start fluid. Can we retry to another kidney access because he has more fluid?
You can't find an intravenous. You can't.
Vuoi provare a reperirla?
Sì, vediamola perché abbiamo bisogno di
Time. So back into the room, okay? And thank you. Grazie.
Thank you.
Yeah.
Thank you so much. So I wrote some notes. It's an leadership. She did recognize us eventually, and probably follow the call forward and echo an extra. It's a good point. Good point.
That way, because they were only able to get 10 kilos.
Right.
Because they were trying to give fluid antibiotics until they may be in the IV. They were so worried about having access.
Right, right.
If they're being intramuscular. I think so. That's the big thing to me is that it just needed to just jump to put
Yeah,
it
yeah.
that usually in the drugs.
I agree.
And then they could just go.
They did call anesthesia at the
Yeah,
end.
and then the way the game plays is that anesthesia never arrives.
Right.
That never happens in our hospital.
But yeah.
So I think that's, to me, that's the.
It's good leadership.
Yeah, I mean, that's the difference between what she knew. They're able to talk.
Yeah.
That you can walk.
Yes.
Fast.
Yes, of course. And this is where we learn.
Okay. That was good. I just go so same thing, right?
They never
Same.
started inotropics.
What's that?
They didn't start any inotropics. They talked to me. Gotcha.
Okay. Bruges. Coach? Great. So just get a chair, sit in the corner.
Okay.
That'd be great. Grazie. So just some points to reinforce. Do the scenario in the language you're most comfortable. If you've been practicing a lot in English and you want to do it in English, that's okay. If you've been practicing in Swahili, that's okay. So just whatever works for you. If it's in Italian, Raffaele is going to be talking to me constantly. Okay.
We would like to try in English.
That's okay. That's great. Whatever works best for you.
Meanwhile, if you have some problem, maybe
If you have to switch, and do Italian part weekly, that's okay.
Thank you very much.
Second point, make sure that we understand what you're doing. If there's something important that you say to your team leader, I think we should do this, or I think we should call for whoever to help, make sure that you tell us, because if we don't know, right? Yeah. I'm going to start by giving you the scenario, and I can give it in English or Italian, whatever you want, just let me know. And then what we'll do is that it will start, it will be 10 minutes from when I finish.
Maybe if it's okay for you, the scenario in Italian, and starting from that, we will talk in English. Okay? It's okay for you?
Yes.
Perfect.
Okay. All right. So this is a 4-year-old that has been brought into your hospital by his parents. So,
Ok, a 4 anni è stato portato all'ospedale dai suoi genitori.
the child has been admitted to
Il bambino è
hospital
stato ricoverato
because of high fever
perché ha febbre alta
and confusion.
ed è confuso.
The nurses in the hospital
Le infermiere
called you
dell'ospedale nel reparto
to come and assess
per venire e
the
valutare il
patient
paziente
because he is becoming increasingly confused.
perché è più confuso del solito di prima.
Okay.
Okay.
Okay, thank you. So guys, we have a 5-year-old with fever and confusion, and they're calling us to evaluate this child. So let's build our team. Beta, timekeeper, Naji, drugs please, Angie, circulation, Martina, airways, and Chiara, please, cardiomonitor. So, for starting, please let's attach the cardiomonitor and let's take all the vitals. Okay guys? So let's start with repeat the primary assessment. Some PDA please.
Okay.
Meanwhile, Nanji, let's take the temperature. Don't worry.
Are the airways open?
Yes.
Are they maintainable?
Yes.
Okay. Are there secretion red
No.
bodies? Okay. So the airways are open, maintainable. There are red bodies and there are secretions.
Okay, thank you. Let's.
Is he conscious at the moment?
His eyes open, he's confused, he's mumbling.
Okay.
He's not talking, he's just mumbling.
Okay, let's start with a C, and after that, please, I'm ready with you.
Okay. Okay, the pulse, the central pulse is present.
Okay.
That central pulse is weak.
Okay.
Okay.
Okay, thank you.
Nanji, meanwhile, please, let's take an IV access. Let's take all the lab data with the phlogistic index and also an EVG. What about temperature? 39. Okay.
And the
I
peripheral,
cannot hear the peripheral.
the peripheral pulse, there's no peripheral pulse.
Perfect.
Okay.
Okay.
And
And
then
on
pulse,
okay. We have a lot of vitals. Okay. We have
Let's go on
sinus
with
loss,
the-
tachycardia.
What about time, perfect time, please?
It's 4 seconds.
Okay, and what about preload sign?
It's 1 to 2 centimeters below the ribs.
Okay, then so we have preload time 4 seconds preload time and 1 to 2 centimeters hepatomegaly.
What about SpO2, please? 93? Okay.
Yes.
Please, just one moment, guys.
Yes.
Please, Martina, let's take a non-repeating mask with 100% of oxygen. Let's put it. And Nanji, yes, do we have an IV access?
Yes, it's okay. The view.
Yes, you have an idea.
Okay, so let's put paracetamol. How many kilos our child?
18.
Okay, so 15 milligrams per kilos, okay? And after that, take also, please, an hemoculture.
It's possible to have a paracetamol.
Yes, we have paracetamol. Yeah.
Okay, and please, Nanji, after that, take also an hemoculture. Before other drugs, let's go on with B, please.
Just another question, what about extremities?
They are cool.
Cool, okay.
You do notice that there is a rash that's beginning to spread
Okay, all over the...
all over and moving up his arm,
Okay.
up his
Yes, a rash all over the body and extremities are cool and I follow with a P.
Okay,
Giovanni, and the paracetamol I took on the exam, so you are yes.
also the hemoculture?
Yes.
Okay, please, let's try to take also a lung puncture after the first evaluation. Okay? And we have to also give the first dose of antibiotic in the first hour. But let's complete the primary assessment. Tell me everything?
I put another repeating max with 100% of oxygen.
Yes. What about the CO2? 94.
Yes.
If you want, you can try to put also again. Okay? Thank you. Meanwhile, we are going on with the primary evaluation, so the C and B. Okay. Put it away, don't worry. If we have a nasopharyngeal airway device, we can try.
Do we have a nasopharyngeal airway?
No.
Okay, don't worry. Let's continue.
I have the antibiotics I administer.
No, not now. Let's finish the primary assessment,
Okay.
then do
The
one.
number is symmetrical, but
Okay.
I hear wheezing.
So the lungs are clear,
Okay.
normal.
No.
Okay, okay, thank you. Okay.
Lungs are clear.
Lungs are clear.
Okay, thank you very much. So please, let's go on with the D and the exposure, because it's important in this case.
Okay, perfect. So what about an ABQ? Is still other?
With stimulation, he's moves with
Okay,
stimulation.
and what about the pupils?
4 and 4. React.
And 4, perfect, reactive.
Okay.
And exposure, we said that is this rash.
Rash.
Anything else?
Okay.
Just rash.
Rash all over the
Okay,
body.
guys, let's try a first identify and then with an interview. Okay? Are you with me? Okay. So we have this 4-year child, and he has fever, rash, right?
Okay, perfect. And main VPU that is about verbal stimulus. Okay, so he's still conscious but not so good. So maybe we are in front of an infection. In fact, we have taken all the lab data with the phlogistic index. We have just done paracetamol. In fact, after that we have to check again temperature and hemopulsion. Now we are going to do the first dose of antibiotic with ceftriaxone, okay? If you agree with me, so 100 milligrams per kilos. But before that, please let's take also a lumbar puncture, if you agree with me. Let's see. Do it. Okay. Okay, timekeeper, please let's go. What?
You don't have the needle for lumbar puncture.
Okay.
There's no.
Don't worry. So please, timekeeper, while we going on with the secondary evaluation, meanwhile, Naji, I'm sorry, let's start also with a single bolus of isotonic fluid, okay? 10 milliliters per kilos into 20 minutes, because we have some signs of prelude. Meanwhile, please, timekeeper, let's call the ICU and also the infectivologist, okay? The ICU, because our patient is not so stable, maybe we can need their help for maintaining the airways and the respiration. Okay, so let's start with the secondary assessment. Let's take again the pressure after the bolus, please.
You call ICU will be active about.
Okay, thank you, Naji. So we have done the first bolus of isotonic fluid, okay?
It's still running.
It's still running.
Still running.
Okay, so our pressure maybe will not improve.
Can I call the...
Let's go on with the secondary assessment.
Okay. Are the airways open, maintainable under
Yes.
suppressions?
Yes.
Okay. So the airways are okay.
Thank you, Mattina. Let's go on.
Okay, so I follow with I'm trying to call the ICU and the nephrologist in 5 minutes.
Okay, thank you very much.
Giovanni, we have depression. We have lower pressure, 60 to 29.
Okay, don't worry, but our first bolus is still going on, okay? So maybe after that it will improve. We don't know yet.
Okay.
Naji, if you agree with me, due to the condition of our patient, we can try also to put a urinary catheter and also take a urinary culture.
Yes. Okay, Giovanni, the murmur is bilateral, but I can hear crackles, basal crackles. And how about the distress signs? Are there any sign of distress at the moment? No. Okay. So, can I follow with the circulation?
Yes, thank you.
Okay.
What about pulse?
What about refill time?
4.
4, still 4. Okay. And preload signs?
1 to 2.
1 to 2. Okay. And extremities are still cool. Okay. And heart rate is 150.
Okay.
And we have a pressure about 60, about 29.
Okay.
And the pulse.
So weak,
Okay.
Weak central.
Weak.
no peripheral.
Okay. Central still weak and the peripheral.
Okay.
No pulse.
Okay, thank you. So guys, let's go on, okay? Let's try again with the disability, please.
Yeah. Is still lethargic but responsive to
Not
light.
responsive.
Not responsive to light. So
Oh, sorry. Like yes.
yeah,
okay.
it's responsive to the light, but not responsive also to pain stimulation. Nothing.
A little bit.
So
A little
it's
bit. Okay.
responsive, just a little responsive to the pain stimulation.
Okay. Okay, guys, we have to go on. Maybe stronger than before. Okay. So imagine let's put a second bolus, always 10 milliliters per kilograms. But after that, we can also try with a vasoactive agent. Okay. So let's also try, due to his condition,
Okay,
with
stop.
1 microgram of epinephrine.
See you in the other room. Get going. Okay.
Thank you for everything.
Grazie.
In case the challenges that are not available,
You can vote one.
Yeah.
And I will stand after that. I need to meet after.
Okay. Michael, can you do me a favor?
Yes.
You don't have to go in the app now.
Sure.
But maybe just for the 4 teams that we've done, while it's still fresh in
Yes.
why don't you assign the number of stars?
Okay.
You do it in the app where you write it down, and then we can go over it.
Okay. Sounds good.
Okay. Thoughts, Michael?
I thought the second team was superior in that they had a clear leader who delegated well, recognized shock early on, did call for, I think he did call for antibiotics, gave 2 boluses if I'm correct.
The problem, they just finished the first 10 per kilo.
I know.
At the 10-minute mark, and they were just about to draw up the second one.
Yeah, I like that. They put O2 on quickly, even though it was really not a respiratory problem. They were very organized. They were very organized. I like the balls. They did call anesthesia, if I'm correct. Did they call anesthesia?
Yeah. Called for it, yeah.
So, and then they called the ICU. So I think overall, they were more likely to get this patient under control, stable than the first one.
You know, there's challenge with both of them was, you know, at least the first team talked about putting an IO in. These guys didn't put in a second IV, did they?
No.
So they're once again doing the same challenge of trying to do everything. In fact, even before they get fluid, they were giving IV paracetamol, IV antibiotics, when they should have get fluid, right? They should have got an IO in. I guess the second thing for me, which is one of the, which is from a medical standpoint, a fatal flaw, is in an unstable hypotensive patient, they were going to do an LP.
Yes.
So I think so. I probably, if they had to choose one, I'd probably go with team 1.
Okay.
Although there's problems with both of them when it comes to the time to defend. They both let the patient sit.
And neither asked for an X-ray early on, or at all, or an echo.
And even if they did,
I know it wouldn't be a while, but just to ask for it.
Yeah, I agree on terms of the talking. The second team leader did a really good job of talking, but it's not. I think to me, it's the difference between the talk the talk and walk the talk, right? Good. All right. So are you okay with that?
Yes.
I'd probably go with team 1.
Okay.
And then what I'm going to do is I'm going to talk to these guys, focusing on it's all the time to fluid. What are the things that you can do? There are things such as low receptor from 100,000 things that we can do to get the pressure up while we're waiting for the infusion to start. While we're fluid.
Yeah, because the blood pressure seemed to just they're not looking at the vital signs as frequently as they should.
Well, the problem is they're seeing it, but they're not intervening.
Right. All right. Today? I don't even know. It's happening so fast. I don't know. It's very quick. Do you go to the school here? What school do you go to? Are you in medical school or you're IT?
I'm like a medical school.
Okay.
I do a master for product specialist for medical devices.
Oh, excellent.
Yeah.
It's going to be good.
And 1 year ago, I started to work well from medical.
Excellent. Oh, excellent. Okay, yeah, I mean, this app is great, but I think it's phenomenal. You can develop it where it's like, you just put in the points after it, like stars, and it automatically tabulates who the winner is. Like, I thought the second team was better, personally, but he's the doctor. So I thought the second team was better, but
not that.
no, I'm a respiratory therapist.
Ah,
Yes.
yeah.
At Children's Hospital. I know a lot of countries don't have respiratory therapists. But, and you know, I've been to 1,000 of these, so I'm going by like early intervention, etc. It's very interesting.
Yeah.
It is hot in these rooms. I think it's a challenge, like, you know, a fan would be nice, a big fan.
Can you use open so?
Yeah.
Okay.
Thank you.
Let's start with CPR. Matteo and CPR coach. Matteo, please stand in line. Monitor on.
Chiamo anche il cardiologo per abilità.
Okay, we have a call cardiologist and
am I able to euthanize you live?
No.
Okay,
Davide, I suggest I'm also.
obviously, thank you. Start.
I put it 2 centimeters above the knee and adult to the
When you can,
and
start with analyze the rhythm and the sequence. Okay.
take a flash to break the records.
Come on, guys, you're good.
Okay. Okay, that's
Okay, start with analyze the rhythm, Marta.
Yeah, so la sensoria sono shock rate.
Okay, start with
I put the 0.1 ml of adrenaline, 1 to 10,000 by drops.
Okay, we do with analysis of the process.
I put the adrenaline.
Done the adrenaline, and see how we are correcting. Hypovolemia, we have to correct. Not help, you can start
I'll try the proprio.
very good. Any bonus? Hypoglycemia. Okay, hypoglycemia, we have to correct. Eventually, we have a stick of glucose.
It is 70 milligrams per deciliter.
Okay.
70.
You can. I asked you that's blood gas test.
What blood test?
Yeah.
Blood gas. Yeah, it will be back in 5
Okay,
minutes.
thank you.
And I'm able to take another intraosseous accessive and the other.
Direction. There is what's the rate massage.
No.
No. Okay, so your attention rate.
Good.
Sì, la sistolia, shuffle.
Okay.
Continue.
Shuttle rhythm. Okay. Matteo, you can.
I have done the first element and put 20 milliliters per kilos of slice selection. The other.
Allora, prima. Matteo, you can you can base on following to take P and send to laboratory for toxicology. If you are not able to have P, you can do a blood test for toxicology, okay?
There is any urine from the catheter?
Not yet.
No.
You can do a blood test, okay? And we send it to toxicology lab, and we waiting for news. Clinical, if you agree, radiology and cardiology.
Cardiology
You
is
can-
already called. Now we can call radiology for maybe an X-ray of the chest and an echoplasty.
5 minutes.
Okay. Do we have family members here we can talk to?
I'm sorry.
Do we have family members here? No.
Cancer, we have news about radiology or cardiology. I get the cardiology to
Radiology, 5 minutes they come to the echoplasty and
Okay.
I can add another dose of adrenaline.
Okay. Time to evaluate. 15 minutes. 30 seconds. Okay. Matteo, you have to prepare. Very good.
I'm still ready.
There is both massage.
During massage. Okay.
You can't feel the pulse during massage. No.
So you have to change.
1 second.
Bye. Nice. Thank you.
Sì, la sistoria, shuffle. Continue.
Okay, I put the second dose of adrenaline in the number 1.
Thank you.
And unsigned selection flash. I've done all the drugs. Done it.
Okay, thank you.
I
Do you
got the
have
rescue
news?
team again. Are they coming? I got the rescue team again. Are they coming?
That'll be here in 5 minutes.
Okay, thank you.
And the blood test gas we have now or not? Okay, good. We have done everything. We are correcting everything well as possible. Okay. We can ask X-ray. We are in the test. Echoplasty we are the test. And echocardio we are.
In the meantime, we
There is
The reasoning, guys. Sodium is okay, potassium is okay, and calcium is okay. we have 1 minute to evaluate. Calcium is equal calcium. We have to integrate very good, because we are in rest. Okay, we can start prepare it and somministrate the calcium chloruro. The glucose is still 7. Okay.
1 ml of calcium chloruro.
Okay.
Okay.
Okay. We have done calcium chloruro in 1 ml per kilos, right? 1 ml per kilos in 2 minutes. Okay. 50 seconds to evaluate.
Massage? There is compulsory massage?
No.
No? Okay. To drop a kilos or ok, tornando a vedere di la testoria sono anche a sciopero.
Change and go. Oh, we have pH 0.9. We have You can try to do a dope.
Okay. The tube is dislocated.
Excuse me?
The tube is dislocated.
I think it's okay.
Okay, any obstruction?
Nope.
Okay.
Just moves well.
Okay, no pneumothorax?
No.
No? Equipment? Okay. Okay.
We have news about our cardiology or radiology.
So, in what, the substitution team? Is that what you're asking?
Cardiology or
About 4 minutes.
4 minutes, okay. We go on. Matteo,
I prepare another blood gas line, the broadcast system, to check the electrolyte.
Okay, we want to check the improvement of the electrolytes. We ask blood test gas and gap, okay? 30 seconds to evaluation, guys. Very good. We have news about the toxicology lab.
10 minutes.
Okay, now I prepare another
There is both the last
No.
So, assistonia shampoo,
I put the third dose of adrenaline, 1 ml per kilo, 0.5 ml per kilo from solution 1 to 10,000.
Very good, Matteo, thank you.
And a secondary flash of saline selection. And done.
Okay. Allora, hypoxia, we are we can easy course is okay, the latter we are correcting. Hypothermia. We have a temperature.
37.
37 is good. We don't have to correct this. Intoxication, we are waiting for lab. And we are waiting for cardiology and radiology. Okay, go on, guys.
with a change of the picture.
Stiamo assaggiando, ragazzi, quindi ci confondiamo. Go on with Marta, vai. Okay, go on. Go on.
Guarda, continua.
Is conscious?
No. Okay, stop.
Thank you.
Okay, back into the room. Okay. These are the rooms. Well done.
Okay, thank you.
Yeah, I think we held off until about 9 minutes. We'll do this again. But that would be if we're happy with this differences. So I'll let you do 8 minutes.
How many time you want to arrive at the next step? Cioè, to arrive at this step. In quanto tempo vuoi che arrivi l'osso?
How long after the simulation was lost?
Yeah, so Ross, that's October. Okay. From if we are okay.
Sì, ma dal 0 a 150.
Yeah.
Quanto tempo vuole che lo
Like from 0 to 115.
Okay. They never had a shot for the rhythm, correct?
But you know what they did, which is really interesting, which is a high performance team will do this. They'll actually charge while CPR is happening, do a quick rhythm check, and then say no, non-shock.
I didn't notice that.
Which is very few people do that. You got to be careful you don't shock your team.
Well, right.
Okay.
This is the third one. Okay. Zaragoza.
So this is the halfway mark. Okay.
I'm going to write in the blackboard. Okay. White. Ken. Espera. Oh no. Right. Hello.
Hello. Hello, Zaragoza. Are you from Spain?
Yes. Do you know it in North?
I've never been to Spain. I'm from the United States, Philadelphia.
It is a city between Madrid and Barcelona.
Okay.
Middle of the way.
Well, it's about fun. We're gonna have fun.
Yeah.
Okay. When you do a scenario, use the language that you're most comfortable in. Right? If you practiced a lot in English and you want to do it in English, that's okay. If you're more comfortable doing it in Spanish, that's okay too, right? It's honestly, it's whatever. We want to make sure we made the. You don't speak Spanish, though, right? Are you comfortable doing it in English?
Yes, I like practice in English. Right, maybe we have some flexible here, but.
That's fine. It's just because what's helpful to us is that when you guys can tell us what you're doing, right? You decide you're going to call for an X-ray. Tell us you're calling for an X-ray, so those kind of things. So that's language. Communication we talked about. What we're going to do is when I'll give you describe the case, and then once I've finished the description, time starts, and it's 10 minutes.
Are we always going to speak with you?
If you've got questions, I'll give you the answers.
Relatives, other.
That's right.
Okay.
There may not be all that information. Okay? All right. You okay?
Yes.
All right. Have fun. Okay?
Thank you. Thank you.
Okay, you ready? So, this is a 4-year-old that was at home with the parents, with mother and father. He was irritable, not feeling well. The father told him to go and lie down. The father then went and checked him 20 minutes later, and he was pale, not breathing, unresponsive. The father picked the child up. The hospital is just down the street. The father picked the child up and ran to the hospital.
Okay.
You were in the emergency room.
Okay.
The father comes in. The child is now on the stretcher in front.
Okay.
Okay?
Should I repeat?
Whatever, if you need to repeat in Spanish.
It's fine, it's fine. It's fine. Do we know weight?
20 kilos.
20 kilos.
Okay. Please, so let's do the first approach.
Okay. Is he conscious? Is he conscious?
No.
No. Okay. Is he breathing?
No.
No. Okay.
Just take a moment for taking your clothes and the mask. Okay. Get the bag for the ventilation, the first 5 ventilations. Connect to the oxygen. Maybe I need a filter. Connect to the oxygen. Okay. 50 liters, 60 liters, 10%. Okay. 5 ventilations, I will check. 2, 3, 4, 5. Check.
We have the pulse. Vital signs. Start monitoring.
Okay. Okay, so we are on cardiac respiratory arrest, okay? So we're going to start with the massage. And we're going to put the 2 electrometers so we can properly. I try to make it perfect. Okay, we are in an arrest, so we need to get the assistant very soon. Just try it once and then take the material for the infrasound, okay? Laura, you need to come over the material for the infrasound.
You need to take the reading.
Okay, yes, wait a moment. Stop 1 moment. 1, 2. Assistor, yeah, okay, no shockable break. Thank you, Anne.
Is the line in?
We are going to take the material from the filter line and we're going to prepare the adrenaline. Okay? You have the adrenaline? Perfect. So, Laura, you go for the adrenaline. Okay, 1, okay, 2, okay? As soon as we put it, the okay, okay. After the evaluation, we will change. Okay, now okay, perfect. So, the adrenaline, yes, the reduction of the dose, and you are doing 2. So, adrenaline here, variability. So, we are going to evaluate the patient every 2 minutes, and in the next evaluation, we will change for the massage. Okay, now?
Okay.
With her.
Okay.
Okay, perfect. Okay, girls, so we have this kid, 4 years old. We don't know anything about him. Do we have
some relatives that we can ask with in this moment?
So the family they've gone. The father is gone. Yeah.
So we don't have any information. Maybe we can check the temperature very quickly. Okay, but we are expecting an hypothermia and the patient was home. True. But that will change the algorithm of the cardiac arrest. Okay, we will take another adrenaline piece, okay? Sure. So we can take 47 for this expert, so normal as 1, 2. So we're going to think about the vision of the cardiac. Okay. Maybe this patient has some previous illness, we don't know. Maybe you can check in the association if this is something asymmetric circulation. If you check, okay, 1, 2.
Do I have the second IV access?
No.
The only thing that we know is that the patient was feeling bad. He was missing a irritability. He was not responding properly. Maybe some neurologic condition. So 1, maybe something like revaluation.
12 points.
With
No points. Estigas historia.
okay, change. Perfect. On the next one, we will
administrate
the next operation. So you can be aware of that. Okay. If you don't take that one, you have the early access.
Do I have the second one?
No.
Okay. Take that difference one. Okay. So we can have
How much time am I with adrenaline?
2. Okay. 2. Okay. So perfect. You will together. We have the material prepared, as I see, for the intubation.
Yes, we are
ready. Okay. I'm going to thinking about the risks. So maybe we can administrate some fluids. Okay. So we can prepare
I'm with the resources.
Okay.
Any fracture in this leg?
Okay, so proximal tibia, can you prepare some fluids?
Yes.
In the back alone. Okay.
200 milliliters of
fluids. Yes.
Saline physiology. Is the IV pattern here?
Intraosseous.
Okay. Okay. As start fluid, 200 milliliters or saline?
Quickly. Well, you can check maybe the body or something around.
Do we see something on the skin, like some deformities? Do we see some lesions on the head?
Nothing.
Okay. If using saline solution.
Okay. We feel something on the belly, like the
Patomegaly.
nothing. Okay. So continue like that. The most important now is to do the perfect CPR. Okay. So be very aware about the change. So we are going to change to the next one, and we're going to administrate the adrenaline on the next one. Okay. Yes. The fluids. Maybe we can try to get a blood gas. Maybe we have some electrolytes abnormalities, so we can think about that. Okay. If you can take it from the finger.
Evaluation now.
Evaluation now.
Do I feel pulse?
No, it's the same historia, change with Ali. Adrenaline now, okay? Laura, I was adrenaline.
Okay.
I was checking the adrenaline given by maybe access. So that would be one of the aids. Then there is not the acidosis and electrolytes will be checked with the blood test, and maybe toxics could be. So, but for now, we don't have like
Fluids administered.
we can say, but we have it in mind.
Okay.
Okay. Ask for the results. If we have, if one can have it now.
Do you want to get?
I am free. Are you okay? Are you okay? Okay. On the next evaluation, we will try to do the incubation of the patient. Okay. So you can do the ventilation or better than we are doing now. Okay, so we are taking some sample. You are taking sample tips. So maybe you can send it to the lab. I guess they are not going to get the results, but it's fine. Send it to the lab. Okay. Trauma, disease, pneumothorax was symmetric, and echo, yes, we can try to get it and bring it out, and we can do a fast echo, just taking something and let us think about the condition of the patient. But for us, it's broken. It's broken. Okay, broken, no problem. One, okay? Yes. Okay. So, you have administrate the adrenaline and the fluids. Yes. Maybe we can go for help. Okay? So you can, I'm going to start with the change. Yes. And I'm going to go to the ACU. Okay. So they can, you come here to help us. Okay?
Are the results okay?
Yes, we have the results for the
Evaluation now.
evaluation first.
Pulse?
Pulse?
No. Still as historia?
Okay, it's the same. We change. Perfect. We are going to calculate the
Dose of the bicarbonate. Angela, please.
Okay, this patient has an acidosis. Metal unrespiratory, both of them. Okay, for the rest, everything is fine. Okay, so we are going to try the inflation.
Okay. You're ready?
Yes.
Do you have the
Yes.
Yeah. Maybe you can go to the evaluation, Amaya.
How much time do you have for the evaluation, Angela?
1 minute.
1 minute and 30 seconds.
Okay, I try.
We can try.
Okay. I try, okay?
Do you want me to administer it?
Yes, administration.
So, considerations on edema.
Okay. Bicarbonate 1 molar, 10 milliliters and 10 milliliters of glucoside.
Can I see the cords?
Are they able to see the cords in the intubation? Are they able to see the cords?
Yeah.
Yeah. Okay. So try.
Tube number 4.5, tube 13.5.
Yeah.
Okay.
Do that, and I do the auscultation. Okay. Symmetric auscultation. Symmetric auscultation.
Yes, please. Okay, can you sit?
So now you have to ventilate but not coordinating with the massage, okay?
Okay, great. So we have a business in those department. Okay. So just administrate one and okay, great.
Yeah. Ah, no, not yet.
If you are taking notes,
Wait, graduation. Do I feel pulse?
Yes.
Yes. Pulse? Okay.
Hey. Hey, back into the other room.
okay. I'm sorry for that.
Quindi non abbiamo segni di precarico, possiamo intanto fare un'infusione, abbiamo fatto l'infusione fisiologica, facciamo una rivalutazione, vediamo il respiro è migliorato.
Is breathing better or is
He's breathing. Now we hear a little air movement.
Ok, quindi il salbutamolo ha funzionato. Ok, quindi oltre alla fisiologica che mettiamo.
Sì, metto su 10 ml per chilo di soluzione fisiologica in 20 minuti, quindi 150 ml.
Ok. Prepariamo il
Ho l'anamnesi, allora, è un paziente che ha preso da molte allergie, ma non allergie a farmaci o alimenti. A casa fa il salbutamolo al bisogno, è stato ospedalizzato nell'ultimo anno 3 o 4 volte per problematiche asmatiche, l'ultimo passo 6 ore fa e si è svegliato stamattina con un attacco asmatico sostanzialmente, ha preso salbutamolo, non ha risposto.
Allora prepariamo qualcosa di allergia. Prepariamo il salbutamolo più libratropio. Ok. Prepariamo un altro aerosol con salbutamolo più libratropio. Ok? Sì, libratropio. Sì, prepariamo anche il cortisone. Facciamo anche il normopason, desametasone, endovenoso. Prednisolone.
Facciamo 15 mg di metilprednisolone e siamo al secondo aerosol, dopo 20 minuti facciamo salbutamolo, 10 gocce più una fiala di pratropio.
Facciamo una rivalutazione dello stato di coscienza del bambino. Ok, rivalutazione neurological evaluation.
He's getting a little more awake, a little more alert.
Ok, un pochino più sveglio. Ci risponde. La saturazione è sempre la stessa, sempre 89 la saturazione.
the one that you can see.
Proviamo a mettergli
87, proviamo. Esatto, proviamo a fare una ventilazione, proviamo a fare una PEP con la maschera, ok?
Quindi collegato.
Ok, colleghiamo con il reservoir 100% a muro per fare 95% e una PEP.
They just connect to oxygen without ventilation.
Okay. Oxygen to do a pressure, positive pressure. Okay. Okay.
And now I believe the B. Okay.
Yeah, he doesn't like the mask though. He's starting to get upset. That, yeah. He doesn't like that type of mask.
With the reservoir. Okay. So the adaptation.
His air movement has been a little bit better, yes.
Okay. And it's symmetrical.
It's symmetrical.
And the work.
Work of breathing is a little better.
Ok, penso che potremmo fare anche, visto che è febbrile, potremmo fare comunque una copertura con concentrazione di azitromicina, quindi d'accordo? Ok, azitromicina. Ok.
Allora,
Okay, and
rivalutiamo sì.
the respiratory frequency. Now, rate.
Respiratory rate now is 20, I don't, what's it say?
Is that one?
A little bit better.
Little bit.
io prenderei per fare lega.
Ok, facciamo la gas. Okay. And we are waiting because it's going better and the therapy is working, so we wait and we evaluate, okay?
facciamoci.
Molto con la C.
Dai, che facciamo una ok, va bene.
Like the refill.
Cap refills normal.
Okay. Pulses.
Pulses are fine.
Okay. And the auscultation. Can I hear the sounds?
Yes, now we can hear breath sounds.
Okay. And
Wheezes, bad wheezes. Inspiratory and expiratory wheezes.
Okay.
Okay.
Yes.
Okay, so it's going better. Okay, it's going better.
Pressure is the same.
Ok, if we have, se abbiamo due rubinetti possiamo fare anche del paracetamolo, terapia del rubinetto.
If the IV has two accesses, like they wanna give sublingual.
Paracetamolo.
Ok, faccio 15 mg per chilo di paracetamolo.
15 milligrams per kilo of paracetamol.
La saturazione sta migliorando bene.
Possiamo metterlo su magari.
La frequenza si tratta
Sì. Can we that's it? Okay.
Yes, you can.
Okay. The count, okay. Everything is going okay.
Quindi abbiamo fatto
Time. Well done, well done. And now, please try to
Into the other room?
Yeah.
No? As long as you're consistent.
Yes.
Whether the thing is that you were happy with or the thing is that you were unhappy
Yes.
with, just do it the same way.
I was happy that they progressed
And just
Okay. All right. Same thing for this group. Thank you so much. Yeah. Unless they're not progressing, and then I'll write it down. Okay. I'm going to do a mental.
Yes.
Okay.
Did anything after 10 minutes?
Yes, okay. This is, who's this, Sienna? Sienna. All right, it was fun. I've never ran a simulation before. Yes. Yes. Welcome, Sienna.
Thank you. Hi.
My name is Michael. I am a respiratory therapist at the Children's Hospital of Philadelphia. And I will give you the scenario and try to speak in whatever language you feel comfortable. Will you be speaking in Italian or English?
English.
Okay, okay. All right, Raphael is a translator.
Yes.
But you can look to me for any questions about the progress of this patient, okay? Our scenario is he's a 4-year-old, just came in the emergency room. They triaged him right to the room, and he's really having a lot of trouble. He's a 4-year-old, parents are outside the room, 4-year-old, really having a lot of trouble breathing.
Does we have a weight of the baby?
18 kilograms.
Okay, so guys, 18 kilograms. We're here told. Are you ready, everyone? Yes. Okay, let's press our DPI. Okay. Does it breathe spontaneously?
Yes.
Yes, with a distress, okay? The state of consciousness?
Yes. Kind of, he's she's crying, you know, he's sounding.
Okay. Okay, and the body color?
Pardon me?
The body color? The skin color?
Normal.
Normal, okay. So let's start with the monitoring.
Yes, I'm putting the signs and the PG monitors. Okay, see the rhythm, cardiac, oxygen 89, hypnotic. You ready?
Okay.
Okay. Is there a patent?
Yes.
Yes. Okay, and sedation?
Minimal.
Minimum, okay. The saturation is low and the tachycardic. Any respiratory effort?
Bad. Yeah, like really, really subclavicular retractions.
Okay. Okay.
Tachypneic.
Don't you have the Mayara? Is bilateral?
She's not sure.
It's symmetric. Bilateral, okay. And do you listen some signs, some different signs? Like troubles? Okay. Can we assist for the oxygenation?
Yes,
Can we put a mask?
I put a mask with the squad. 12 liters per minute, 100% of oxygen.
Okay. Is it also pure?
Yes.
For the circulation?
Central and peripheral pulse. I listen.
Breath sounds are almost not, like very, very decreased.
Okay.
Not moving air.
Okay. Capillary flow.
Good, normal.
Do you have any problem with time? Liver, jugular?
No.
Okay. Blood pressure, we take now?
Normal. Blood pressure, normal.
We can't take the blood pressure?
Yeah. Normal.
Can I take an IV access? Okay. Do we have some stop clock? Three-way stop clock? Because I don't find anything on the... Yes, okay.
Yeah.
I take a venous gas, blood count, serum, blood culture. That's it.
Okay, thank you. The pressure?
Pressure?
Yes, okay, so it's hypotension.
Hypotension.
Can we finish the evaluation?
Yes, state of consciousness.
He's conscious, but he's kind of...
Okay, pupils.
Yeah, pupils are normal.
I take off the clothes, I look something in the skin.
Skin's fine.
Okay. Abdominal pain?
No.
Okay. No neurological sign?
Say it again.
Neurological sign?
They're fine.
Can we have a dextrostic?
Yeah, capillary glucose.
Normal.
Normal. So guys, it's a shock, probably septic shock because we have a fever, okay? So we need to talk to the mom if there's something. Mommy, can I do the bonus? Yes.
20 milliliters per kilo. Okay, so 360 milliliters in 10 minutes.
Okay, so thinking about the reevaluating the fever, okay? And yes, okay. Can we again the state of consciousness?
Blood pressure is normal. It's normal. I can't tell what that number is.
It's normal the
It's
pressure?
normal, yeah. It's normal.
Okay. The state of consciousness right now?
It's okay. He's awake. He's awake. He's irritable.
He's irritable. Okay. Will you release the state? Bilateral?
Yeah.
Don't worry about the voice. If it is bilateral, just okay.
Low saturation. Okay. 84.
Yes, I think it's the same.
Reload sign? Do you have the reload sign?
No reload. In the past, I reloaded. Now,
Reload's fine.
okay, we have the same for the same. Repeat capillary, any difference?
No.
Okay.
Breath sounds are very decreased.
E i rumori pulmonari sono quasi azzerati, quasi non si
Okay.
So guys,
Okay,
so guys, it's a probably a respiratory disease, like does we have the hemogas before that we did before?
Blood gas is ready.
Blood gas will be ready.
Okay, can we try to do some salbutamol to
Yes, can I take another reaxis?
Yes, you can.
Can I take another reaxis?
Yes.
Okay. And stop knock.
Can we do the RSO, please, Mami?
Yes. Yes. Do we have something to do the aerosol?
Yes.
Okay.
Yes.
Something like this. So 20 drops of salbutamol and 500 micrograms of ipatropio.
Can we also do a methylprednisolone in milk?
Yes.
So guys, we have insufficienza respiratoria. Yes. Probably due to an infection. We are now doing the salbutamol and the ipratropium, and we are preparing the cortisone in vein. We did a dose that stands for the pressure. From the anamnesis, only the salbutamolic therapy. So okay, should be like this. We need to evaluate the here the gas. So the gas is 7. Is a little bit acidosis 7.33, 31 of CO2 and 38 of oxygen. So
Venous.
is it venous?
Is it venous?
Gas?
No, arterial.
Arterial.
Okay. So it's a yes, it's a respiratory effort. Lactate. How many is this one?
19.
Lactose.
One carb 19, base X is -4.
Okay. So can I do the methylprednisolone?
Yes.
2 milligrams per kilo, so 36 milligrams.
Okay.
Here
Okay.
in bottles. Okay.
Mari, can we do another hemogas because we
Arterial one?
Yes.
Okay.
And then try thinking about another kind of ventilation. Maybe we can use the high flow. Okay.
Yeah.
But before we
need to use the high flow, can I?
Yes, you can.
Can I do the arterial gas? Okay. Done arterial gas.
Perfect. Thank you guys. After doing the high flow, we need to reevaluate again. Okay.
Okay. High flow is on for setting
35% of oxygen. I think it was
18 kilos.
How many liters high flow?
25. Yes, 24 pills.
For start, maybe.
Yes. Can we reevaluate him?
Yes, of course. Now we have high flow and we have for the Mavi, for the aerosol. Yes, we have it's on the first one. The first one is on. Have you already done the first one aerosol?
Okay.
It's done.
Yeah, I want to hear his lungs sound a little better now. Now we hear bad wheezing, really bad wheezing. Inspiratory expectation. Still work the breathing.
Un po' visibili, gli ispiratori ancora difficoltosi.
Okay, so guys, we can repeat the other.
Yes.
About thinking about also the magnesium.
Yes, of course.
About the circulation, sorry.
It's possible to ask him a little help.
Yes.
Okay.
So, second aerosol with 20 drops of salbutamol and 500 micrograms of ipratropium.
In the evaluation, the pressure will be better than before.
The saturation's coming up.
Saturation, okay. The blood pressure will go up. Central nervous system is okay. Hepatomegaly or any preload sign.
Any preload sign?
What signs? Preload signs?
Any preload sign?
Fine.
Okay. Capillary field.
Good, normal.
Okay, so a little bit recap. An important attack with fever. So we are at the second aerosol. We did also the methylprednisolone in vein. Maybe can we also do the acetaminophen to the
Yes, sure.
Because we have double stop. And then we need to talk to the X-ray if there are something that we didn't understand. And then we have to we put the
Right on. Yeah. Okay. Do we have acetaminophen? Because I can't see here any.
Yes.
Okay. Saturation is better. Yes.
Perfect. Okay. Right. Perfect.
Okay, round up. That was my first time I ever I know I found but I wanted to see them progress. And they were. They both were. It took me a while to realize, you know, but no breast ads. It's not a good thing.
So in terms of fitting models, is
the second team.
Yeah, I was going to say, because I don't think the first team, the second team talked about high flow, talked about getting a chest X-ray. Yeah, I wonder, the second team also, in COVID, we were so sensitized to respiratory viruses, to go into PPE. First team didn't do it, second team, they all asked, right? Which is really cool.
That is really good.
So go for it.
All right.
And just I'll log into the queue. We have 10 minutes.
Okay.
And we still got 3 more teams.
Okay. How many more?
2 more. 2 more. So Michael, you want to just debrief fast?
Yeah.
And
okay, that's perfect.
I know she's got it. She can be downstairs with you. Be interested to find out if we're actually charting in the are they doing a lot? Good. I'm going to have to be putting some assumptions in the comments on that.
Ma che sta abbiamo finito, no, manca una squadra di video, no.
No, ma scusa, no, io lo so che devo normale, però.
No. Hai fatte 8? Anche a me sembra un piedino, no? Non ti aspettavo. Tu hai Pisa? Tu hai Pisa? Pisa, sì. E dopo dici chi sono? Mi indichi, mi dici questi sono Pisa. Lo metti un grosso scenario, non era 105. 10.
And Michael, just slip into the back, come in.
Okay, will do.
Che ne so, Pozzo periferico solo in sinistra, giusto?
Ma me lo dice, lo vede.
Questo non funziona, no?
No, ma il corso lo chiede a lui direttamente.
Ok. Adesso la fine stanno qua. Possiamo appoggiarci su questo tavolino oppure... Ok. Io c'ho già pronto il time.
It's the afternoon, isn't it? What language have you been practicing in? You've been practicing Italian?
Italian.
Because Raphael will translate for you.
Okay.
What are you most comfortable with? Make sure that when you are going to be phoning for consultants, or you're calling for an X-ray, what you're doing is you're going to be telling us
Quando
also.
chiamate le consulenze, dici sempre cosa state facendo, se no non capiamo.
Okay,
So
okay.
we need to hear that you're
Okay.
going to be calling for that. I will start the scenario, and once I finish, the time starts.
Iniziate, mi dici lo scenario, poi appena finito di parlare inizia.
10 minutes.
10 minuti.
Okay? Happy? And this is fun.
Yes, very fun.
Fun for me, not fun.
Yes, for us the second time. So.
Yeah.
Just because we like that.
Yeah. Okay. So this is a 4-year-old that has come in, been brought in by the medics into your emergency room. The child was thought to have taken some kind of pill or pills. The paramedics found the child unconscious and breathing very slowly. This is what the child looks like. Do you understand? Do you want a translation?
Facciamo una traduzione comunque per
Il
sicurezza.
bambino ha 4 anni, i paramedici lo portano nel posto di pronto soccorso, pensano che abbia preso qualche pasticca perché l'hanno trovato incosciente e come vedete adesso.
Ok. Ok.
Go.
Ok, io sono ragazzi sono il team leader, tu lui che sai vedere, tu stai tu valli la A, tu la B, la C, tu la D, ok, tu stai farmaci di fianca, e tu Matteo stai monitor, e tu mi aiuti con il tempo, ok, il bambino è incosciente, abbiamo detto, il respiro è irregolare, il colorito com'è?
Breathing is pale.
Pallido.
Breathing very slowly.
Ok, dovrebbe essere in classe, quindi vediamo se ha polso. Vediamo se ha polso.
It's clear.
Ah, ok. Ok, so it's not breathing. Ok, quindi ritiriamo per favore la maschera. Ok, quindi le vie aeree, fai il CD, ok? Ok, le vie aeree, quindi siamo restretto. Vai, manca per favore, metti il monitoraggio, per favore, metti i due accessi venosi. Ok, il saturimetro. Ok, tu Francesco inizia a valutare.
Chest is moving.
E il rumore è chiaro.
Ok,
il rumore è chiaro.
Ok.
Ho messo 2 accessi, vanno?
Yes.
Ok. Continuiamo la prima.
Ho messo cardiomonica e
Configurazione.
Left check, oxygen saturation.
Aspetta, vai, facciamo un paziente con un problema in C che è la frequenza cardiaca ridotta, facciamo il rescue breathing, quindi lo metti alla sua frequenza abituale per un minuto, poi lo diamo se necessario la cardiaca per entrare nel mondo della rescue, ok? Intanto la cosa in vaccino.
Pozzi per i freddi,
settimana.
Weak.
Deboli.
La pressione, vediamo la pressione.
Blood pressure.
La pressione l'ho messa al braccio destro.
Abbiamo messo 2 accessi, sono andati, sono perdi. Ok, dai,
Intanto sento il polso centrale.
vai.
Central pulse.
Ok.
Ok, 4 e segni di precari per
Freedom signs. 1-2
Cosa manca la C? Abbiamo messo tutto? Sì. Ok, andiamo alla D. Passa le pupille per favore.
They are 1 bilateral and reactive. 1 millimeter, 1 millimeter. Okay.
Ok. Reattiva. Ok. Allora, quindi la V più abbiamo detto che è incosciente. Quindi abbiamo preso qualche cosa, possiamo passare alla Ok, quindi lo sfogliamo per favore, presente quelli che sono la famiglia. Tu, per favore, Peppe, che sei per chi, per fai il T-Sample, ok? Ok, possiamo parlare.
No family.
Ok, non c'è nessuno, ok. Quindi, ricapitolando, abbiamo un bambino che ha una dicardia sinusale che ha
80 su 50.
80 su 50. 4 anni, quindi
vuoi fare da concetto?
siamo un po' per l'aria. Mettiamo in per favore fare una cassa bianca. Ok, quindi diciamo bradicardia, lo esame di intossicazione, alle pupille ignoti bilaterali poco leggere, quindi potrebbe essere un'intossicazione da quindi possiamo fare una nozione. Dobbiamo fare una nozione, va bene. 0,01, quindi poi da 16 kg possiamo fare 0,16 mg di naloxone. Sì, 3,55 naloxone 0,16 mg. Ok, fai una nozione di 0,16 mg per bolus, ok? Ok, nel frattempo possiamo passare al...
Fate naloxone.
Okay, so in naloxone, it's take another 2 minutes.
Okay,
yeah, you have to look at it.
2 minutes, sorry.
C'è ancora 39 di frequenza. La pressione bassa. La C vede una pressione molto bassa.
Allora, c'è una speranza che dobbiamo in realtà passare al... Quindi ricordiamo da capo. Quindi lo stiamo ventilando. Ok, respira spontaneamente.
Yes.
No. Quindi però respira, quindi va bene.
Perché l'ossigeno è al 100%. Si va sul cuore, la pressione
ok, farei un volo da 10 ml per chilo, quindi quanto pesa? 16 kg, 160 ml. 160 ml,
di cosa?
0,9 di fisiologica.
Sì.
Ok, vogliamo pure valutare la rosina oppure vogliamo... Quindi il T-Sample, però non chiede se sono gli genitori. I genitori sono arrivati, parents are there. Ok, naloxone is ready?
Naloxone's in.
Naloxone in. Ok.
Lei che abbiamo chiesto,
Hemogas?
il blood gas is ready?
Ok.
Ho fatto il bagno di liquido.
Allora, pH7, 60 di CO2, 15, ok, sodio 140, potassio 5, calcio 1, 70 di glicemia. Quindi facciamo una rivalutazione dall'inizio. Le vene sono in realtà a rischio, ok? Quindi lo stiamo infilando. Poi vediamo se sono i rumori.
Let's see respiratory sounds.
Clear.
Ok, va bene, vai, facciamo da qui.
Pulses
weak.
Debole.
La pressione è quella.
Blood pressure is that one.
Continua a avere 39 di ci sono adesso sedimbre cariche dopo il volo.
Preload signs after fluids? No.
Ok, va bene.
Per chi?
Sempre 4.
No, c'è anche la
motion do another bottles or
sì.
Domani che pratica?
Facciamo
una persona. Sì, direi di sì. Ok, sempre da 0,16
mg. Another naloxone.
Ok. E ragazzi, vogliamo fare la turbina o non lo
facciamo?
No.
Già è radicato.
Ok. Quindi abbiamo questo bambino di 4 anni che si è intossicato da opioidi, abbiamo fatto il naloxone, 2 naloxoni, abbiamo fatto anche un volo di fisiologica, la pressione di vuota è l'unico parametro che ci tocca la frequenza cardiaca. Ok, lo stiamo ventilando perché la frequenza respiratoria è un po' bradiploico. Ok, quindi può avere una insufficienza respiratoria da approssimazioni. Ok, cosa posso fare? Non ci sono i genitori, quindi ok. Vai e va bene. Facciamo la B, vabbè, facciamo
Let's give altri punti.
Ok, 0.02 quindi 0,32. 0,32 tra i 20 e i 60 minuti. Ah, scusami. In 5 minuti. 0,32 mg.
Esatto.
Ok.
Fare 0,2 mg di eroina.
Fatto la dropina.
Ok, nel frattempo possiamo, per favore Peppe, tu staccati, vai a chiamare il cardiologo, ti spieghi il caso e chiediamo ECG a 12 derivazioni.
Ok, posso parlare con il cardiologo? No, 5 minuti. Ok.
Faccio minuti arriva, no, nel frattempo questo è l'esegista? Esegista? Ok.
La prima sensale del cardio, cioè il team sono appunti
dovrebbe essere
c'è il ciclorasso, no, io direi che no, bene, buono.
Ok, facciamo questo caso, iniziamo, io volevo
queste cose che la sensazione di CO2 per il calcolo, come la vediamo nella CO2, aumentiamo la velocità di ventilazione.
Dovresti discutere ventilare
increase the ventilations, increase the rate of ventilation, yeah.
Il coraggio adesso risponde meglio?
Perché devo casa
Is the thorax expanding backwards?
Chest is moving well.
Il coraggio si muove.
ragazzi.
Peripheral pulses?
Weak.
Debole.
La drena possiamo fare, oppure fare
Ok. Alright guys, back to the room. Alright, and we'll talk, do Madonna, and then we'll talk, okay? They can't see the monitor. Is that we should be talking to Michael about that?